Hi, everyone, and welcome back to the next installment of UConn KDSAP's webinar series. Today, we're going to be talking about pre-health opportunities. But first, we're going to go ahead and do some introductions.
Hi, everyone. My name is Maria. I'm a biological sciences major with a neuroscience minor, and I am a senior at UConn this year, and I am also from Bethel, Connecticut.
Hi, everyone. My name is Abby. I'm a junior psychological sciences major, Spanish minor, and I'm from Seymour, Connecticut.
Hi everyone, my name is Simran. I'm a biomedical engineering major at UConn. I'm also currently a senior and I'm from Western Massachusetts. So some of you may be asking yourselves, is it too early for me to get healthcare experience as a high school student? Well, the answer from us is absolutely not. It's never too early to start to figure out what you really want to do with your life. And a great way to start answering this question is to get some experience in the field itself. Maria will give you a little bit of an introduction on as to how to really do that.
All right, so we'll begin with HCOP, or short for Health Career Opportunity Programs, and this is offered by UConn Health at Farmington. And this really encompasses a wide variety of programs, starting all the way from middle school, high school, and again, all the way to college level. And these programs are designed for the recruitment and retention of students from diverse groups who are underrepresented in American healthcare professions, as their mission statement reads. You can explore their website using the hyperlink, and you see that once you go under their enrichment programs tab, you can choose specifically high school students and check out all the programs offered. And again, this is a great way to explore the healthcare field, and it's also a really great opportunity to create mentorships with the faculty at UConn Health, and also potentially meet other students who have similar interests as you and going into the healthcare field. And this is a really awesome, especially if you're near the UConn Health area. But now we're going to move on to talk about their specific programs and see what they each have to offer. Okay, so we'll begin with the Doctor's Academy. So this is offered for all the way from 9th through 12th grade for high school students, and they're offered in 2 sessions. So one is in the summer, and one session is held in the school year on Saturdays. So you can choose what better fits for your schedule. And something to note about the program is that Hartford Public Schools students actually receive priority, and they also get transportation to UConn Health if it is needed. And the Jumpstart program, as this one is called, is specifically tailored for freshmen in high school. So this is the one where only 9th and 10th graders can apply. And they offer multiple classes in language arts, math and science. And they also, offer tips on like college preparation, and especially with PSAT tips and tricks. And as we said in our previous webinar about funding your education, the PSAT is super important, especially for qualifying for merit scholarships that could potentially get you full rides for colleges, which is something that I personally did not know as a high schooler. And some of the requirements to apply are be a 9th or 10th grader, like I said before, have a B average or better. You do have to write an essay you have to submit. You have to get 2 letters of recommendation, and you also have to show your high school transcript. So next we have the Junior Doctor's Academy, and as the name says, this one is tailored towards juniors in high school or 11th graders. You can see that the classes do differ based on the change of grades, and you also receive SAT or ACT preparation, which is also really great because I know it can be really daunting to have to study for a standardized test on your own, and it's helpful when there's others around you who are also taking the same exam and going through it all together. And the requirements are, again, the same, except you have to be a junior. And lastly, we have the Senior Doctor's Academy, which is geared towards seniors in high school. And here they offer college preparation, such as how to write a personal statement, how to present yourself at college interviews, how to fill out your Common App, things like that. And they do offer, again, ACT and SAT prep if you haven't taken it yet by this point. And the deadlines for all the Doctor's Academy programs are June 1st, 2021. So it's never, again, too early to ask your teachers for those recommendation and keeping up your grades to have this be average or better. And the next program is actually tailored for incoming freshmen matriculating into UConn, and it's called the Pre-College Research Program. So if you are accepted into UConn, you can have the opportunity to conduct research alongside a professor at UConn stores. And it's for the duration of 6 weeks in the summer right before you enter college. And again, I cannot stress enough how much of a beneficial opportunity this program is, because something that a lot of students say that they struggled with when looking back at their pre-med journey is how to find research and where to start, who do you contact, what topics and ideas are there to even research. And I know personally, I didn't have the answers to these questions when I first started my pre-med journey back freshman year. And I actually didn't begin to get involved in the research lab until my sophomore year. So again, with this program, you'd have a head start, something to put down on your resume before even entering college. And although many professors are willing, to mentor you with no experience, it doesn't hurt to see that you have some sort of research experience. So this really only puts you, ahead of the game. And you can also be, connected with somebody at UConn, from the get-go, summer right before you even start college. And you even might find out about what topics you want to research, or the topics that you don't want to partake in, which is just as important to figure out as well.
So another program that is part of the HCOP initiative is the High School Student Research Apprentice Program. So this is a program that's approximately 6 weeks over the summer. It is geared towards more upperclassmen high school students, so for 11th and 12th graders, but you do have to keep in mind that when you apply for this program, you do have to have finished your junior year already, and for these students who actually are enrolled into the program, what it basically focuses on is providing you with actual research experience in basic or clinical laboratories. And as Maria stressed, this is so important because it gives you a little bit of an edge when you're actually entering college and have something to talk about with the PIs, and providing you that, a little bit of a speed into getting your hands directly dirty rather than kind of being babysat along the way. And keep in mind that this program does offer you a multiple lens into different research fields. So it's not necessarily only science heavy wet lab based research. It can also be applied towards dental medicine or biomedical research, and not just strictly medicine. And this program is actually held at either UConn Health or Central Connecticut State University, and it does require a daily commute to actually get to your program, but students can earn a stipend to kind of make up for any transportation fees or any other fees that are associated with actually getting there. And keep in mind that the deadline for this is early April. This year was April 1st, 2020. So if you are interested, just make sure to keep your eye out that you don't miss the deadline, because it is really early. And another program that HCOP also has is the Pre-College Academic Enrichment Program. This is also offered at UConn stores and CCSU. And these programs are basically for students who are matriculating into a four-year university. And once again, the priority is provided to underrepresented students from backgrounds such as being African American, Hispanic, Latino, Native American, Native Alaskan, or Native Hawaiian. And this program is actually only 5 weeks long, so not as long as the previous program I described, but the main purpose behind this is to actually help pre-freshman students build their foundations to do college level studies, especially in science and math. Because when you enter this program, or when you go into college, into whatever designated field or major you choose, the expectation is never that you're just automatically inherently great at science and math. There is definitely a learning curve, and these programs are geared to help you build your skills to actually study. No one is born insanely smart. It does take time, effort, and dedication. And this is what the program really provides you with, an opportunity to even build those skills before you get a GPA slapped on yourself, like measuring your aptitude at being able to take exams well. For this program specifically, they do provide you an introduction into chemistry, biology, physics, and calculus, and the program also provides you room and board. So there isn't a commute involved in this program. Very easy. For the UConn campus specifically, they do allow you to actually go to UConn Health to actually network with health professionals and get a little bit of a more in-depth experience into what the healthcare field is really like. For this program, the deadline to apply this year was actually May 1st, 2020, but once again, keep your eye out for next year because dates may change. And now Abby will give you a little bit more information regarding more HCOP conferences that are also available to you.
Yeah, thanks, Simran. So pre-health conferences are a great way to get involved, as early as high school, and you can continue participating in college as well. They'll allow some experience with those in the healthcare field and are a great way to kind of explore some of your own interests. And beyond that, you can put these experiences on your college application or even on your resume for a few years. So 2 specific conferences through UConn Health, through the program that Maria and Simran have kind of gone into, are the Bridge to the Future Science Mentoring Program and the High School Mini Medical Dental School Program. And you can access information about these programs and applications through the QR codes or the links on the slide. So the Bridge to the Future Science Mentoring Program occurred this past year in April. The website did not specify, unfortunately, whether or not the event would be completely virtual this year or in person, but either way, the program is designed to, allow interactions with college admissions workers, medical, dental, and research faculty. They give information about the MCAT and the DAT, which are exams kind of like the SAT and ACT that are used as part of the application process to medical or dental schools. You can also hear anecdotes from medical, dental, and research students. And this event is for high school and college students. And again, the application form can be found through the QR codes by scanning the link on the slide. And next up, the Future Science Mentoring Program is for in-state junior and senior students. So they must be selected by guidance counselors or science teachers. So if you are interested, bring it up to your counselor or your teacher. And students in the program will watch a 2-hour lecture once a week for 8 weeks from faculty at UConn Schools of Medicine and Dental Medicine. And topics can include molecular biology, pharmacology, cardiology, oncology, and dental medicine. And once you get to college, you might actually find yourself, overwhelmed by the amount of opportunities that there are to attend conferences and lectures, whether it's pre-health or otherwise. There are presentations on research in every department, presentations aimed to help you understand pre-health and so many more. So again, once you get to college, it won't stop, but you have to just keep your eye open for these opportunities. And next up, Simran's going to talk a little bit about leadership and how to show it in your pre-health activities and even the small things you do like writing emails.
So leadership doesn't necessarily mean that you have to be class president and be president of 5,000 different clubs at your high school. Leadership is about really taking initiative and really following your passions in something that you're actually interested in is meaningful to you. It is better to really explore 1 or 2 things rather than 50,000 things to really showcase where your strengths and interests lie. And Maria will kind of get into how to take initiative with more of your pre-health experiences.
All right. So, talking about advocating for yourself, you might be, scared to ask about shadowing, or, even going up to a doctor and asking to do this kind of thing. But it's actually a lot more common than you might think. And most likely, the doctor that you go to or the doctor that's sitting in front of you at one point in their life also had to get exposed in some way and shadow another doctor. So again, don't be afraid to pick up your phone and call some offices nearby. There are a ton of resources out there that will literally tell you exactly what to say when someone answers the phone. You can really just look up shadowing call templates and follow that script. It's all on Google. And one tip that I found is that if you find private offices, it's best to send an email to both the physician and the office manager because they are more likely to see your email and also respond to it rather than a busy doctor. And the office managers are usually the ones in charge of the schedule. So you will most likely have to go through them anyways to set up your shadowing day. And in terms of, what is it like once you land your shadowing day, you have to be prepared. And some tips that I have is bring a notepad to take notes. It shows that, you're interested in what you're doing and you're being attentive. But also make sure that you do not use any identifying information, patients such as like name, date of birth, and any other details. And again, you have to show professionalism and dress business casual, but also keep in mind that you might be walking around a lot of the day. And most importantly, you have to be ready with questions. Again, afterwards, the doctor is most likely definitely going to ask, do you have any questions? And if you have none, it looks super bad. It looks as if you haven't been paying attention. So it's very good to, prepare a couple of questions beforehand. And I've actually linked a document that shows you a few examples, such as like, what is your favorite part of your job? What is the biggest challenge as a doctor? Again, these might sound like basic questions, but you are there to make sure that this is the setting and the type of job that you want to be in, and explore, other career options and, even explore specialties. So next, we're going to talk about the very important skill of writing emails. So we're going to do a small exercise. We have a sample email written here, and I'm going to ask Abby and Simran to tell me what is wrong with this email after you read it.
So some of the glaringly obvious things that I see wrong with this email would be, some of the spelling mistakes, such as right here in sign, there's no H in sign, or some of the grammar errors.
And another thing to keep in mind is when you're writing an email, you're actually trying to talk to someone, right? Obviously not face to face, more virtual, but you're still trying to get into direct contact with an individual. So it's very important to actually address the person by their name and perhaps list a little bit about them and what you're interested in their field of study. So it's not this vague general email that could be sent out to anyone at all. It is very important to remain professional when you're speaking to these physicians and office managers because they are in the power to grant you the ability to shadow. So it doesn't look well on your behalf to kind of keep it casual when they have PhDs and all these degrees that make them qualified.
All right, thank you, Simran, for those awesome tips. And as you both answered, we can clearly see that there's grammar issues, there's spelling issues, it's completely botched up. And actually, the student ends up not really asking a question. So I know that when I read this, I was still left feeling a little confused as to what exactly they're asking for, what are they asking me to do? And I'm also, very bothered by the lack of periods and the overall lack of, professionalism that this email evokes. So now that we know what not to do when it comes to writing an email, let's look at a very much better revised version. All right, so I'm going to give you a couple of seconds to read it. And so in this version, we can see that, the student begins by also addressing the person who they're talking to, just like Simran said, and also introducing herself, putting in information, such as where she would go to school and what grade she is, really, again, just introducing yourself. And in this email, we can see that she also straight up asks her question and is very clear about what the purpose of the email is. And she also says, when she is free to come in, and the tone overall just comes off, very polite and professional. And again, with emails, you really want to do as little emails as possible. So you want to put as much information as you can in your first email so that your next correspondence doesn't have to keep going back and forth with questions. So some, overall general tips when we learn from this exercise is that, especially when you're writing an email asking someone to, shadow, is again to state exactly who you are and why you are emailing them. I mean, you want to, really provide some context as to why you're emailing them, such as, I'm exploring the healthcare field and I want to then learn directly from you about your specialty. And again, in here, I've also included a resource if you want to, see some more examples and information about email etiquette from the Office of Undergraduate Research right here at UConn. And so next, we're gonna lead into Abby talking about volunteering opportunities.
All right, so we're gonna start off talking about why volunteering in hospitals is important. So it basically comes down to experience in a healthcare setting. You get to learn about what it looks like, and if after that exposure, you can decide if it's still something that you're interested in pursuing for your career. Beyond that, you can earn the satisfaction of being able to help others. And besides that, you can also add these experiences to resumes, college applications, and if you continue during your undergrad to your medical school applications, dental school, or whatever you choose to pursue, and can possibly even get letters of recommendations from experiences such as these. So, what type of work would you do volunteering in a hospital? There's no easy answer to this because there are so many jobs that you can have volunteering in a hospital. But the important thing to remember is that you are not providing any medical care, as you're not certified to do anything medically, but you can still support the patients and the families in other ways. And as I said, there are many positions available. So, for example, you can work bringing around the book cart, bringing books, magazines, crossword puzzles to inpatient units. You can have a clerical position where you work as a receptionist, answering phones or filing forms. You can work in hospitality, showing visitors around or giving them directions, working in the gift shop. At Hartford Hospital in particular, they have a mobility is medicine job. And in this, you would help patients who don't need physical therapy, but they really need the encouragement to get up and move around and walk. Another option is patient transportation or pet therapy. If you have a certified pet therapy dog, you can bring the dog in. And besides that, you can read to patients or provide musical entertainment. So as you can see, there are plenty of options. You could definitely find something that you would enjoy doing volunteering at a hospital. So to answer the next question, what does the time commitment kind of look like volunteering in hospitals? So this is going to vary program to program, but most have a 6 to 8 week summer program for high school students where you would volunteer for around 50 hours, again, depending on the program. And do you need to provide any medical information to volunteer? Most hospitals will require that you give proof of your immunizations. If it's during flu season, that you would provide evidence of having a flu shot. But again, if you're volunteering in the summer, this wouldn't apply. And finally, most will ask that you get a tuberculosis skin test. So how do you go about applying? You can search up local hospitals and look on their websites to see if there are applications available on the websites, or you can email and call to get more information. And on the next slide, I'll have more information about some specific programs. And besides that, will hospitals be open for summer 2021? Unfortunately, I cannot give you a definitive answer to this. Most hospitals don't have any information on this right now. You know, of course, they're extremely busy trying to fight this pandemic, so we're unsure about where we'll be as of next summer. But it's still important to keep this on your radar in case they do end up accepting volunteers over this summer, or so you can apply in the future. So these are just some of the specific hospitals in Connecticut that offer large high school volunteering programs. But again, if you have a hospital closer near to you, definitely do some research, see if they have an application online. But Hartford Hospital offers a program for teenagers where you would work 48 hours in total, and you have to work 6 weeks over the summer to complete those hours. Like most of these, you would first attend a mandatory information session. In this case, it would be about in February. And they require 3.0 GPA and 2 letters of recommendation. And most of these programs request that you apply in the winter before the summer that you want to volunteer. So Bridgeport Hospital is through Yale New Haven Health. And again, for this one, you have to attend a group interview, which is about in March. So again, it's important to keep an eye out for these opportunities beginning in the winter before you volunteer. And this program runs the end of June to about mid-August. And similarly, it has similar hours where you would work either at Bridgeport campus 1 day a week from 9 to 4:30, or you would work at the Milford campus 2 half days. Wyndham Hospital is also through Hartford Healthcare. Although it's through Hartford Healthcare, they do have their own application process, so you would go to the Wyndham Hospital website in particular. And we also have the Hospital of Central Connecticut and the Danbury Hospital. And again, it's really important to keep an eye out so you don't miss the application deadlines, again, look in the winter. And to reach all of these applications of these specific hospitals that I mentioned, again, you can use the QR codes. And next up, Simran will be talking about some volunteering opportunities that you can do other than volunteering in a hospital setting, especially with the pandemic going on.
And again, just before that, again, you might not think that you can get a lot of direct hands-on experience by volunteering and doing all these what seem like odd jobs, but the best part of volunteering is the patient interaction. So, at the end of the day, you want to make sure that you have good people skills. You're there, to comfort people, and they're also comfortable in that environment of a hospital. Simran, take it away.
So as Abby mentioned, we don't know what next year's going to look like, right? We don't know if hospitals are going to be taking you guys in to volunteer. We just don't know. So what does that force you to do? It forces you to really adapt to the situation, right? What can you possibly do that doesn't involve directly in person, talking to people, meeting, connecting with them? Well, there are a couple opportunities out there that do allow you to kind of build your people skills, but you can do it virtually. For example, the crisis text line, they are currently accepting volunteers, and what they do is train you to become a crisis counselor, and you work remotely through a computer, and a requirement is that you have secure internet connection, and you basically just text people who are in need of someone to listen to them or have an emergency. So your job would primarily be to calm people down and really just actively listen, respond to them, listen to them, and collaboratively problem solve whatever issue that they're currently facing, and this is extremely important because this is what you're going to be doing as a health professional. It's not necessarily you're going to be curing cancer. You're going to be talking to people. It's a people field. And with the crisis text line specifically, the people that you come in contact with might have extreme forms of anxiety, emotional abuse, depression, suicide. And this is not mutually exclusive from the people you might be facing in a hospital or clinical setting when you are a health professional. And especially during the pandemic, there's probably a lot of people out there where all their feelings and all these symptoms and mental illnesses are probably exponentially increased because of being in extreme isolation and other factors that the pandemic has exacerbated. So even doing this little thing that you may not think is significant, and like working in a hospital, talking to actual people, even texting people can make a big difference in someone's life. You just don't know. Similarly, Seven Cups is another organization where you provide emotional support to people across the country. You again work remotely, and this is through a chat box. So not necessarily texting, but it has a similar structure. The people that you may encounter could have depression or other forms of anxiety. So this organization will also train you how to really talk to these people and get them the help that they need. And the good thing about these programs is that since they are virtual and you do work remotely, they do cater to your schedule. So they're not going to assign you a specific work time that you have to come in, spend those hours, and then go back home. This is completely up to you and works around your schedule so that you can go to school and do the other activities that you're interested in, and you don't have to stop your life to do this specifically. And besides the crisis text line and Seven Cups, there is another opportunity to help volunteer through the American Red Cross. The American Red Cross actually has a variety of volunteer positions that are open to the public. For example, they have community education programs where they require people to come in and get trained on whatever the topic is. And it does require you to have public speaking skills and good communication skills. But also through the process, if you don't have those, you are able to build those. Because as a future health professional and wherever you work, speaking to people, having that ability remains important. The other fields that the Red Cross actually gives you the option of working in are boots on the ground, client facing, or behind the scenes. Boots on the ground specifically is that you physically respond to emergencies in person. So for example, you can respond to home fires, you can work directly with families, veterans, and it is known as a more physically intensive shift, but they only require one shift per month. You could be delivering blood, and that is another job that would be part of being the boots on the ground. Client facing specifically is more along the lines of counseling and talking to people. So once again, you're talking to families or individuals after disaster or crisis, problem solving with the clients, and having basically one-on-one interactions with them. This is a more people-centric work than what I previously described. You may not necessarily come into patient contact with the boots on the ground, but the Red Cross have described client-facing as you directly talking to people. For behind the scenes, this is more administrative work. So with the pandemic, if you're not an essential worker, most likely they'll have more volunteer positions open for more administrative tasks and operational tasks. Training will be needed to volunteer for these positions, but they will provide you with the training that you need for the position. So with the American Red Cross, there's a lot to do, and you can basically choose how you want to approach volunteering for them or not. It's really up to you. But one thing that you should get from this slide, if anything, it's that there are options out there. You know, you're not completely cut off from the outside world and gaining those pre-health experiences. It's a little bit tricky to kind of navigate it and find them, but they're there for you. So now Maria is going to give you a little bit more information regarding virtual opportunities that will help you gain more pre-med experiences during the pandemic.
All right, so lastly, we have Club Med, which is sponsored by Siena Heights University. And what they do is they offer Zoom calls where you actually get to shadow healthcare professionals, from a variety of different specialties. You have MDs versus DOs, you have pharmacy, nursing, and current medical students. And these are all videos that are uploaded to YouTube, so you can watch the playback on your own time. And all you have to do is just write a short reflection after you watch the Zoom call, and talk about what you learned, what you saw, who you watched, how it made you feel, like how it was useful, and then just send the reflection to the Club Med email so that you can get credit for these hours. And this is a great thing to do very early, especially because when you go on later to write your personal statement for like medical school or whatever professional school you want to go to, you want to be able to look back at all your experiences and talk about how they shaped your journey. So these reflections are very good to look back on. And so for this program, you can register for their Zoom calls or get reminders about them using that link that's linked right over there. And again, this is a really great opportunity to do shadowing right from your bed or from your couch. But again, don't think that this is the only way that you can do shadowing. You should still definitely try to seek out shadowing in person. But this is a great supplement, especially for right now during the pandemic. And actually, Club Med just recently launched a volunteering program with the activities for specifically the month of October. And all these opportunities include making cards for hospitalized children, making educational TikToks if you're on TikTok, creating a presentation or a workshop that you want to present to an audience. And this one has to be a minimum of 15 minutes into a maximum of 30 minutes. And also they offer a creative way to get started with research with this program called Zoom Universe. And basically what you do is you look up research projects, and you test out, different software, projects, questionnaires, and you give basically data to this researchers that are doing these projects. And again, you can read about all these opportunities more on your own time and read about all their guidelines and what exactly you have to do to get the hours. But what's really great about all of them is that, as Simran said, these are all on your own time and virtually. So I know that's especially hard to come by these days, but again, these are out there. But definitely check out their Insta to see if, if there are more opportunities posted for the next upcoming months. So that brings us to the end of our webinar. Thank you so much for listening. Here's our contact information for each of us, as well as our email, our website, and make sure, keep a lookout for our website for upcoming webinars and the WebEx link. But yeah, thank you so much.
Thank you.
Thank you. Bye.